Welcome to the deep dive. Today we're jumping into something pretty specific, a serious lung condition that honestly has a fascinating backstory.
It really does. It's a condition, a lung abscess, actually, that only happens when a very particular set of things line up.
Right.
So our mission today is to unpack that. What is it? How does it start? And what do we do about it?
Okay, let's start right there. How does something like a lung cavity, an abscess, even begin? What's the initial trigger?
Well, almost always, the first step is a large volume aspiration.
Aspiration, meaning?
Meaning contents from the mouth or throat accidentally going down into the lungs. Not just a little bit, but a significant amount.
Okay.
And crucially, this often happens in someone who already has pretty poor dental hygiene, maybe gum disease or infections that haven't been treated.
So it's that combination, not just any aspiration. What situations lead to that kind of large volume event? That seems key.
Exactly. That's the critical part. We see it, for instance, after a stroke, especially one affecting the gag reflex.
Makes sense.
Or seizures. Significant intoxication is another common one. People aren't protecting their airway.
Right.
And even sometimes after medical procedures like endotracheal intubation, having a breathing tube in.
Wow. Okay. So the body's normal defenses are down, basically.
Precisely. And if you combine that with a mouthful of bacteria from poor dental health, well, it's a perfect storm for infection deep in the lung.
That really does paint a picture.
Yeah.
So once this process starts, how does it usually show up? What would you look for in a patient?
Well, first, you'd almost certainly see one of those risk factors we just talked about. Stroke, seizure history, something like that.
Okay.
But the other thing is, this isn't typically a sudden acute pneumonia. It's often more chronic. It develops over several weeks, sometimes quite sneakily.
Weeks. So it's slow burning. Is there a really obvious symptom then? Something that makes you think, this might be a lung abscess?
Yes, absolutely.
Yeah.
The most striking sign, the classic one, is producing large amounts of sputum.
Okay.
That smells noticeably foul, really bad.
Foul smelling. Okay.
Why is that? That smell is a huge clue. It points directly to the type of bacteria involved, anaerobes.
Anaerobe.
Bacteria that thrive without oxygen. They're common in the mouth, especially with poor dental hygiene, and they can really take hold deep in a lung cavity where there isn't much air.
That connects all the dots. Back to the dental health and the aspiration. So you suspect it. How do you confirm the diagnosis? What tests do you run?
The best initial test is usually a chest x-ray. It can often show the cavity, sometimes with a clear line inside it, an air fluid level.
Like a bubble in the lung.
Kind of, yeah. For a more detailed look, a chest CT scan gives us much better accuracy.
Okay.
But, and this is important, if you really need to know the exact bacteria causing it, only a direct sample, like from a lung biopsy, can definitively tell you that.
A biopsy? Wow. So what about just testing the sputum they cough up? Isn't that standard?
You would think so, but actually for diagnosing the specific condition, a sputum culture isn't very helpful.
Really? Why not?
Because, like we said, everyone has anaerobes in their mouth as part of their normal flora. So when someone coughs up sputum, it gets contaminated by mouth bacteria on the way out.
So the test would show anaerobes, but you wouldn't know if they came from the actual lung abscess or just the mouth.
Exactly. It's misleading. So you rely more on the clinical picture, the risk factors, the imaging, and that characteristic foul sputum.
That's a really crucial point. So once you've made the diagnosis based on those clues, what's the treatment?
Treatment primarily involves antibiotics, specific ones that target those anaerobic bacteria effectively.
Like which ones?
We often use drugs like ampicillin sulbactam, or sometimes impenem, meropenem, or an older but still effective option is clindamycin. The choice depends a bit on the specifics.
Right. So a targeted antibiotic approach. What a journey we've traced from this specific kind of aspiration event.
Yeah, linked to things like strokes or poor dental health.
Through to this very characteristic foul-smelling presentation.
Developing over weeks.
And finally, to needing specific imaging and the right antibiotics while avoiding misleading tests like sputum culture.
It really does highlight how interconnected things are in the body, doesn't it?
It absolutely does.
You have something like dental hygiene, which seems separate, potentially linking up with a neurological event leading to this very serious lung infection. It really underscores how these complex causal chains work. Something for you, the listener, to maybe think about how often do seemingly unrelated health factors actually influence each other?